My name is Dr Manno. I'm an assistant professor of medicine in the Division of Rheumatology. I take care of patients in the Johns Hopkins Arthritis Center and in the Johns Hopkins Vasculitis Center, and I specialize in the care of older individuals with arthritis and vasculitis. My research interest is in body composition, muscular strength, and nutrition in older individuals with chronic inflammatory diseases. Over the years of caring for patients with autoimmune conditions, I've been struck by how often the parameters by which we measure disease activity, such as laboratory studies like ESR or CRP in rheumatoid arthritis or giant cell arteritis, may look normal, and by these measures the disease should be quiet. But the patient sitting in front of me is telling me that they feel unwell, and that they are not feeling unwell because of joint pain from RA or headache from giant cell arteritis or vasculitis. Rather, they're fatigued, weak, and unhappy with changes to their body that have occurred in the context of their disease and its treatment. This experience has led us to ask research questions about muscle mass, fat mass, and muscular strength in these inflammatory conditions. Ultimately, we strive to improve strength and increase muscle for our patients, and we are investigating the effects of resistance exercise on multiple disease parameters. We have our own rheumatology exercise research facility, which has been developed to explore precisely these questions. It is our approach that exercise is a very important part of treatment for any rheumatic disease. However, much work is needed to determine the correct prescription for exercise in older individuals with rheumatic disease. In addition, we are just starting to realize that the old-fashioned saying, "you are what you eat," probably is even more true for individuals with autoimmune conditions. This has led us to investigate the role of nutrition and dietary supplements on inflammation, body composition, and strength. We are also examining correlations between food choices and common symptoms and comorbidities of inflammatory disease, such as dry mouth, pain, and depression. We hope that with a better understanding of how inflammation affects body composition and muscular strength, that we can design specific treatments with exercise and nutrition that will complement conventional therapies for autoimmune inflammatory diseases. I value every interaction that I have with our patients, whether this is clinical care or research. We are learning from our patients every day, whether that is in a formal way through a research protocol or informally as they teach us more about their experience with a rheumatic disease. First, I fell in love with internal medicine. The challenge in internal medicine is to care for the whole patient, balancing pathology in multiple organ systems with treatments. I really enjoy that internal medicine is not an organ-specific specialty. The focus is the successful management of the entire patient. Geriatric medicine, as a subspecialty of internal medicine, is even more complicated because older individuals often have multiple comorbidities, multiple medications, and these two can conflict. Also, in geriatric medicine, extra emphasis is placed on physical function and quality of life for older individuals. I see these as very important aspects of the medical care that I deliver. Rheumatology, specifically geriatric rheumatology, is the perfect intersection of internal medicine and geriatrics. As a rheumatologist, although I am an internal medicine subspecialist, the diseases that I care for, such as rheumatoid arthritis and vasculitis, are multi-system inflammatory conditions driven by the immune system. Therefore, I have the opportunity to care for older patients with rare systemic autoimmune conditions and focus on their comprehensive care, which includes not only managing their inflammatory musculoskeletal disease, but managing the impact of this disease on their physical function, quality of life, and pain. I completed my rheumatology fellowship at Johns Hopkins in 2011, and then I was delighted to be invited to join the faculty. At Johns Hopkins, collaborations between physicians and scientists is encouraged. Our rheumatology division is a perfect example of this. Every single faculty member in our division is committed to patient care and to discovery that will improve the health and wellness of our patients.